all about inflammatory bowel disease. Inflammatory bowel disease, or IBD, is a term that describes a family of digestive disorders that produce inflammation in your gastrointestinal tract, and this inflammation is responsible for some very unpleasant symptoms. The two most common types of IBD are Crohn's disease and ulcerative colitis, or UC. These are known as autoimmune disorders because in both conditions, your body produces an unhealthy immune response to its own cells. Crohn's disease can affect any part of your digestive tract from your mouth on down, and your most likely symptoms are diarrhea, abdominal pain, fever, and fatigue. You can also experience symptoms outside of the digestive system, including anemia, arthritis, eye inflammation, and skin rashes. UC occurs when the lining of your colon or rectum becomes inflamed, causing ulcers in the colon lining. When that happens, symptoms can include the frequent need to empty your bowels, loose stool, rectal bleeding, abdominal pain, and more. You can also have eye irritation, mouth sores, skin and joint conditions, liver conditions, and other issues.
We think of IBD as a relapsing and remitting inflammation condition. It can be triggered by genetics, the environment, and certainly the microbiome, or the bugs that live in our guts, and their interplay. So IBD is a situation in which our immune system is unnecessarily overactivated. And so we use the word mucosa to describe the lining of many parts of our body. The most obvious one is probably the guts, right? The lining of our mouth, the lining of our esophagus, stomach, and all the way down through our intestines. But we have kind of linings of other areas as well. So like our eyes are covered with a lining. Our joints have certain lining that protect and keep certain spaces separate from one another. And so that's the reason why we share kind of inflammatory conditions between that. And if you think about the skin, it's the lining that covers our whole body. And so if inflammatory bowel disease is the GI version of an overactive immune system, then those other conditions would be their respective specialties, overactive immune system.
One thing that IBD is not is irritable bowel syndrome, or IBS. It's easy to get them confused considering how close their names sound, but IBD is specifically related to inflammation in your digestive tract, while IBS is not. The symptoms of IBS can include either constipation or diarrhea or both, along with cramping, excess gas, and bloating. And because IBS is not an autoimmune disorder like IBD, the treatments can be very different. Also note that IBD is not celiac disease. Although celiac disease does involve inflammation, it's specifically triggered by gluten, and when you eliminate gluten from your diet, your symptoms usually go away. Almost anybody can come down with IBD. The Centers for Disease Control estimates that about 3 million American adults have it. And unlike other bladder and bowel disorders that seem to become more common as you get older, IBD is typically diagnosed in younger adults and teens. There also seems to be a hereditary connection, as well as an association between IBD and other chronic diseases like heart disease, cancer, diabetes, arthritis, and ulcers, among others. If you do have IBD, whether it's Crohn's disease or ulcerative colitis, there are a number of treatment options that may help you get back to a more normal life. Changing your diet, taking certain multivitamins, quitting smoking, and increasing your physical activity have all shown benefits for sufferers of either condition. In addition to behavioral and dietary changes, there are a range of medications your doctor can prescribe, including advanced therapies like small molecules and biologics, antibiotics, corticosteroids, immunosuppressants, and antidiarrheals.
Sometimes it does involve limited use of steroids, sometimes prednisone, or sometimes less systemically absorbed medications. We try to avoid medications like Advil, aspirin, Aleve, ibuprofen, because those medications, though it sounds like perhaps an anti-inflammatory medication might be good in this situation, they can actually make the situation worse or exacerbate it. So we usually will take a medication. Sometimes it's a pill medication. Sometimes it's an injection or infusion medicine. Combine that with perhaps some dietary interventions, as well as some behavioral health interventions like helping patients be more confident in managing their social situations with their guts.
Naturally, You should only take medications for your condition, even over-the-counter ones, in consultation with your doctor. IBD disorders are serious, and a physician has the experience to make sure that you follow a treatment path that's right for you. Another reason is that your doctor can also help determine whether a surgical procedure may be worth considering.
Sometimes surgery involves elective removal of certain parts of the colon or small intestine. Sometimes it can happen a little bit more urgently if there's issues with infection or other more serious complications like fistula. But we really believe that the best IBD care happens in the outpatient setting rather than in the hospital. So we try to run a tight ship outside of the hospital, but sometimes hospitalizations are required and sometimes surgeries are required.
Patients with Crohn's disease often get relief from a procedure called a bowel resection, where a diseased part of the bowel is removed and the remaining healthy parts of the bowel are joined together. If you have UC, surgery might involve what's called the J-pouch procedure, where the colon is removed and a pouch is created, connecting the remaining intestine with the anus and allowing you to eliminate as you normally would. In some cases, a more extensive procedure called a proctocolectomy may be required. Here, the colon, rectum, and sometimes the anus is removed, depending on your particular condition. The surgeon will then create a small opening in the abdomen called an ostomy, and a small bag will be fit over the opening to collect waste. Don't neglect your mental health either. Living with Crohn's disease or UC can take a real toll on your self-image, but there are techniques you can practice, including mindfulness and meditation exercises, that can help you reduce stress and anxiety. And never hesitate to seek out professional help when you need it either.
Anxiety and depression are unfortunately relatively common in patients with inflammatory bowel disease. More than a quarter of patients experience symptoms of varying severity. I'm so grateful to have my behavioral health social worker in clinic with me. She offers services like coping with chronic illness. She teaches progressive muscle relaxation and mindfulness strategies. And that book that I mentioned does also have those techniques, including things like diaphragmatic breathing. So there's certain breathing techniques that can help ground patients in the moment and recognize that they still do have control over what's going on in a situation. And so I think that once you've found a provider, ensuring that they do have emotional health resources available is of the utmost importance.
One thing that your emotional and physical symptoms have in common is that neither should be treated on their own. There's nothing noble about suffering when there are professionals out there with the expertise to get you on a path towards healing. And the sooner you act, the better.
If someone notices that they're having abnormal weight loss, blood in their stool, mucus in their stool, if they're having a lot of cramping abdominal pain, or perhaps diarrhea or unusual constipation, that would be a departure of what they had been experiencing in months and years past. Sometimes that would be a good thing to bring to your primary care physician's attention, or if you're already under the care of a gastroenterologist, if there's a family history of someone close to you who has a history of ulcerative colitis or Crohn's disease, that can also be very helpful. When patients are affected with IBD younger in life, sometimes it can be failure to thrive, or you feel like the calories in aren't the calories that are on your body. Sometimes it can be a little more obscure, like anemia or having a low hemoglobin level, maybe associated with fatigue or poor sleep. All of those things sometimes can land you in my office, but with open arms for sure.
Visit the National Association for Continence today to learn more about these conditions, their treatment options, and management strategies. IBD may be difficult to live with, but if you take active steps now, you can look forward to healthier, happier days ahead.